Hi, I'm Preeti. I will be talking about the history and the development of case mix. Case mix refers to different types or mix of patients treated by the hospital, example, respiratory, plastics, etc. The greater the variety of specialty or case mix, the greater the variety of DRG. The mix of patients treated by the hospital also determines the hospital funding as different DRG attracts different funding. It was in the early 1970s Hale University developed Diagnostic Related Group or DRGs to describe all types of patient care in an acute care hospital. The Hale system encompassed the Medicare population as well as newborn, pediatric, and general adult population. Now, what was the need for a measurement system? The traditional CMBS DRG focused on resource intensity only. The US healthcare industry needed a tool that could look beyond these factors and allow agencies such as the State Data Commission to evaluate differences in hospital mortality rate. This tool could support quality of care projects and facilitate the implementation and the use of critical pathways. This led to the development of new methods and refinement to evaluate acute care in hospital and consider the factors that affect the cost of delivering inpatient health services. Case mix complexity refers to an interrelated but distinct set of patient attributes that includes severity of illness, risk of mortality, prognosis, treatment difficulty, need for intervention, resource intensity. The evolution of DRG. The Healthcare Financing Administration, also called as the HCFA, now the Centers for Medicare and Medicaid Services, implemented DRG in 1983 for the Inpatient Prospective Payment System or IPPS. 3M developed an all patient DRG or an APDRG system in 1987 as the basis for New York's hospital reimbursement program for non-Medicare discharge. This system was adopted by a number of state Medicaid agencies as well as commercial payers. A project at Hale in 1989 resulted in the development of refined DRG or the RDRG system, which looks at the severity of illness in the Medicare population. Severity DRG or the SDRG came about in 1993 after HCFA re-evaluated the use of complication and commodities within the Medicare DRGs. HCFA published this system in 1994. However, there was never an implementation date requirement for this particular system. The DRG system. The DRG method assigns a numerical value to an acute care inpatient hospital episode of care, which serves as a relative weighing factor intended to represent the resource intensity of hospital care of a clinical group that is classified to a specific DRG. As a reimbursement system, the DRG assessment determines the payment level the hospital will receive. Four guidelines were established as a guiding principle for DRG system formation. The patient's characteristics used in the DRG definition should be limited to information routinely collected on the hospital billing form. There should be a manageable number of DRG that encompass all patients seen on an inpatient basis. Each DRG should contain patient with a similar pattern of resource intensity. Each DRG should contain patients who have similar form of clinical perspective. In Australia, case mix was first introduced in Victoria in 1993-94 as part of a public sector reconstruction to reduce expenditure and improve the efficiency. South Australia followed in 1994-95 with case mix funding approaching modelled substantially on the Victorian scheme. Since then, Western Australia and Tasmania has implemented the case mix funding both in 1996-97. The DRG classification system has been developed to describe a normal or a typical case in DRG known as inliers. Outlier cases are those that does not fit into this normal pattern in distribution that lies outside so-called trim points. Two funding models has been developed. The fixed and the variable model involves a fixed grant for hospital overhead cost and a payment for each patient treated, covering only variable cost. The integrated model provides an integrated payment to hospital for each patient treated, covering both fixed and variable cost. The introduction of DRG based system is a path of a long path long path is part of a long path of continuous development and adjustment of provider payments. It might involve combining different provider payment mechanisms to arrive at an optimal mix of incentives, as been done in many advanced health financing systems. Thank you.